Hello everyone, welcome to the Senior Medical Hub channel. What would you do if you were suddenly struck by a heart attack while completely by yourself? Imagine this, you feel a pain in your chest so intense it feels like your heart is about to explode and there is absolutely no one around to help you. Do you know, in that terrifying moment, exactly what to do in the next 10 seconds? Trust me, this isn't a movie script. I want to speak to you with total honesty today, just as if you were sitting right across from me in my office. What you are about to hear in this video could truly decide whether you live or die. You see, when you suffer a heart attack while alone, the chance of death can skyrocket to almost 89%. However, if you know what steps to take in those first critical 10 seconds, that probability changes dramatically. Your chance of survival can reach 92%. Do you know what makes the difference? It's the difference between knowledge and ignorance, between life and death. A lack of information can be deadly. That's why today I am going to share everything I've learned in over 40 years of practicing medicine. Just a few weeks ago, I got a call at 3 a.m. On the other end of the line, a woman was weeping. "Doctor, it's a miracle. My father survived. Thank you for teaching him what to do." She was talking about my 78-year-old patient, Mr. Hank Williams. He suffered a heart attack at home, completely alone and without immediate help. He managed to stay conscious, followed the exact steps I taught him months earlier, and got to the emergency room in time. When I met with him again, he said something to me that I will never forget. "Doctor, if I hadn't remembered what you taught me, I would be dead today." What saved his life wasn't luck. It was preparation. It was listening, practicing, and being ready. Today, I want to give you that same opportunity. Comment where you are watching this video, and if you have any questions, comment on that too. If you're finding this information valuable so far, please tap that subscribe button and the notification bell. That single piece of knowledge could truly save your life or the life of a loved one. I am going to walk you through the 8 critical steps to survive a solo heart attack, and I will do it in simple, direct, and human language. This isn't the kind of knowledge they teach in medical colleges. This is knowledge learned from experience in the corridors of emergency rooms and in the stories of people who have returned from the brink of death. But before I teach you those 8 steps, you must understand something critically important. Phase 1, the 5 silent warning signs. A heart attack almost never strikes like it does on TV. It's not like the movies where a character grabs their chest, screams, and falls to the floor. The truth is much quieter, much more confusing, and far more dangerous. The day Mr. Hank Williams suffered his heart attack, everything seemed normal. He woke up at 5 a.m., like always, made his coffee, and sat down to read the newspaper. But suddenly, he felt something strange in his chest. It wasn't a sharp pain, it was an uncomfortable pressure, like something heavy was crushing his heart from the inside. He thought maybe he'd eaten too much the night before, that it was indigestion. But 10, then 20 minutes passed, and the discomfort didn't go away. Instead, it got worse. After 30 minutes, he started to feel a numbness in his left arm, then a slight ache in his jaw, and at that very moment he thought, "This is a heart attack." That awareness was the biggest difference. If he had said to himself, "It's just my age, it's stress, it'll pass," he likely wouldn't be alive to tell the tale. The statistics don't lie. 87% of people who suffer a heart attack mistake the symptoms for something else. They think it's a digestive issue, a cold, or a muscle ache, and as they waste precious time, the damage to the heart continues with every passing minute. Now listen closely. People over 65 who live alone are 4 times more likely to die from a heart attack than those who live with someone else. This isn't because their hearts are weaker, but because when they are alone, they often don't know what to do or they do nothing at all. But this does not have to be your story. Even if you live alone, you can prepare. You can learn what to do and you can act in the right time. Mr. Williams didn't save himself by chance. He saved himself because months earlier, he took part in a conversation where I explained exactly what to do if he had a heart attack alone. And when that moment came, he remembered every single step. Instead of panicking, he looked at his watch, took a deep breath, and said, "All right, I need to start the step-by-step procedure now." That is the difference between a prepared person and an unprepared person. Prepared people remain calm even in the worst moment because they know what to do, how to do it, and in what order. And if you also have high blood pressure, diabetes, high cholesterol, or if you smoke, the risk is even greater. But the most important thing is this: even if you have all these factors against you, if you are prepared, you can survive. And not just survive, but survive with minimal damage. Today, Mr. Williams is fully recovered. He walks, reads, enjoys his grandchildren, and it's all thanks to preparing beforehand. You can do this too. In the next section, I'm going to teach you the 5 most critical signs your body gives you before a heart attack, and how to recognize them before it's too late. In most cases, a heart attack does not come suddenly. Your body gives you warnings. I want you to memorize these signs well, write them down, and share them, because if you ever feel them or see them in a loved one, you can act in time. Sign number 1: pressure, tightness, or heaviness in the center of your chest. This is not a stabbing pain or a burning sensation. It's like something very heavy is crushing your chest, like a rock placed right in the center of your body. Some patients tell me, "Doctor, it felt like someone was squeezing my heart from the inside with their hand." And note this: this pain or discomfort does not last for a few seconds and then go away. It usually lasts for more than 15 minutes and does not improve with common medications. Sign number 2: radiating pain. It starts in the chest, but then spreads to the left arm, sometimes to both arms, the neck, the jaw, or even the upper back. Jaw pain is especially common in women. I know patients who thought it was a dental problem and called a dentist instead of the emergency services. Sign number 3: extreme fatigue without a clear cause. If one day you feel exhausted without making any effort, like your body can't go on, it can be a sign that the heart isn't getting enough oxygen. This sign is very common in women and is often ignored, but if it occurs with other signs, you must act immediately. Sign number 4: sudden shortness of breath and cold sweat. You are resting. You haven't climbed any stairs, and suddenly you feel short of breath, like it's difficult to breathe, and you start sweating cold, even if the weather is cool or you are front of a fan. This is one of the most alarming signs and is often confused with an anxiety attack. But if it happens with chest pressure or radiating pain, it is a clear signal that the heart is in distress. Sign number 5: dizziness, nausea, or vomiting. If you suddenly feel dizzy, like you are about to faint, if you feel nauseated for no reason, or even vomit, don't just attribute it to indigestion. Many people take an antacid or a digestive pill thinking it's a stomach problem, when in fact they are already in the initial stages of a heart attack. And here is something very important. You don't need to have all 5 signs at the same time. Having 2 or 3 is enough to suspect a heart attack. And if you also have risk factors like high blood pressure, diabetes, high cholesterol, or a history of smoking, just one of these signs is enough for you to act immediately. Mr. Williams, the patient I told you about, recognized 3 of these signs: chest pressure, arm pain, and sudden fatigue. And that was enough for him to understand what was happening and to act without wasting time. Because of this, his heart suffered minimal damage. Today, he still walks every morning and enjoys his grandchildren, and I want you to get to that point too. Phase 2: the 8 critical steps to take when you are alone. We are now moving on to the most important part of this video: the 8 steps you must follow if you are alone and begin to feel that you are having a heart attack. You don't need to be a doctor. You don't need special equipment. You just need memory, calm, and resolution. Because even if you are alone, even if you live far from a hospital, these steps can increase your chance of survival by up to 90%. So pay attention, listen calmly, and most importantly, practice it. As you will see, most of these steps can and should be practiced before an emergency happens. We prepare for many things in life, but very few people prepare to survive a heart attack, and that is going to change today. Are you ready? Let's go with step 1. Step 1. Stop everything and sit down in a safe spot. As soon as you feel the symptoms, stop whatever you are doing and sit down in a safe spot. Do not keep walking. Do not think it will pass. Do not tell yourself, "I'll wait a few more minutes." Just stop. Look for a chair or a sofa with back support and sit down with your back supported. Do not lie down on the floor. Lying on the floor makes blood circulation difficult and can worsen your condition. Also, do not remain standing. The priority is to maintain stability and prevent a fall. Mr. Williams was about to go for a walk, but as soon as he felt the chest pressure, he sat down with his back supported on the bench by his entrance. Because of this, he did not faint or fall. That first step, though simple, saves lives. Step 2. Chew an aspirin. If you have aspirin at home, take a 100 milligram tablet and chew it immediately. Do not swallow it whole. Chew it well and let it dissolve in your mouth. Why? Because chewing allows the medication to be absorbed much faster, and it helps dissolve the clots that are blocking the arteries. It is a simple measure, but it can reduce heart damage by up to 40%. A clear case is Mrs. Betty White, a 76-year-old woman who lives alone. One morning, she felt unwell. She remembered what we had discussed in a health talk, and even though she was panicked, she chewed the aspirin. When she arrived at the hospital, the doctors told her that because of it, her heart suffered hardly any damage. If you don't have aspirin at home, don't worry. You can continue with the next step. But if you have a cardiac history, you should always keep a box handy, preferably in a visible and accessible place, like on top of the refrigerator. Don't worry about a thief breaking in. In that moment, your life is more important than any object. Step 4. Adopt a 45-degree recline with your legs slightly elevated. Do not lie down completely, nor sit up straight like a statue. The ideal is to recline your body backward at a 45-degree angle, supported by a chair or sofa, and if you can, elevate your feet slightly on a cushion or pillow. Why this position? Because this way you help the blood flow to the brain and heart without putting too much strain on the lungs or the circulatory system. If you lie down completely, fluid can accumulate in the lungs, and if you sit up too straight, the heart works harder. Step 5. Send a brief text message to your family members. Do not make a phone call. You should not be talking on the phone at this moment. Talking takes effort, and that effort can worsen your condition. Instead, send a brief, direct text message without unnecessary details. Something like, "I am having heart attack symptoms. I need help getting to the hospital. Don't worry, please come now." And do not send it to just one person. Send it to 2, 3, or more family members. This way, you ensure that someone sees it, even if the other doesn't respond. Step 6. Practice deep breathing. Inhale for 4 seconds and exhale for 6. This slow, controlled breathing reduces the heart's work and helps maintain calm and oxygen flow. Do it this way. Inhale through your nose, mentally count to 4, and slowly exhale through your mouth, counting to 6. It is vital that the breathing be abdominal, not just chest breathing. And if you can, make a soft sound when exhaling to make it even more controlled. This technique not only calms you, but also improves circulation and helps you buy time. Step 8. Press the inside of your wrist and cough hard 3 times in a row. This step is little known, but can help you in a critical moment. With your thumb, press hard on the inside of your wrist, right where you feel your pulse. At the same time, cough hard 3 times in a row, continuously. Why does this work? Because coughing generates pressure inside the chest that stimulates blood flow, and pressing the pulse helps regulate the heart's rhythm. It is not a substitute for medical attention, but it is a tool to keep you stable for a few more minutes, and those minutes can be the difference between life and death. Step 8. Remain calm and monitor your symptoms. Focus on staying as calm as possible while waiting for help. Keep monitoring the pain and your breathing. Do not move unnecessarily. Conserving your energy is vital for your heart. Mr. Williams applied these steps with complete precision. He didn't improvise or hesitate. He acted like a person who had prepared. When help arrived, they found him conscious, calm, and in the correct position. Today, months later, his heart works normally, and his story has already saved others who have seen this video. Now it's your turn. Learn these steps, write them down, tape them to your refrigerator if necessary. Phase 3. The 3 golden habits for prevention. So far, I have explained how to act if you are alone and having a heart attack. But there is an even more important thing: preparing before it happens. Because no matter how much you know what to do, the ideal is that you never have to use it, and that is possible. Throughout my career, I have known hundreds of people, over 80 years old, who have never had a heart attack. Do you know what they had in common? 3 simple habits that anyone can adopt and which reduce the risk of a heart attack by more than half. I call them the 3 golden habits. Golden habit number 1. Walk 30 minutes every day. You don't need to run or do extreme workouts, just walk for 30 minutes every day. What matters is not the speed, but the consistency. Let me tell you about Mr. Mike Johnson, a 62-year-old man from Phoenix, Arizona. For over 25 years, he has woken up at 6 a.m. and walked in the park. It doesn't matter if it's cold or hot. My body demands it, he tells me. His last checkup showed that his heart works like that of a 40-year-old, and his only secret is walking every day. Golden habit number 2. Reduce salt consumption as much as possible. Salt is one of the quietest enemies of the heart. It raises blood pressure, stiffens the arteries, and promotes heart attacks. And the problem is that most of us eat much more than we need. Avoid processed products, cold cuts, instant soups, industrial bread, and canned foods. Instead, eat more fruits, vegetables, legumes, and natural foods. Mrs. Carol King, 79, confessed to me that it was hard at first. She said, "I felt like the food had no flavor. But after a month, my palate changed. Now I can't tolerate salty food. It makes me thirsty and heavy." Since then, her blood pressure has remained stable. Golden habit number 3. Quit cigarettes and alcohol regardless of your age. I have heard the same thing many times. "Doctor, I'm already 70 years old. Why quit now?" And I always give the same answer. Because you still have time to improve your health. Mr. John Smith, 74, quit smoking at the age of 70. After 50 years, he said, "I thought it was useless. But in 6 months, I breathed better, slept better, and even started climbing stairs again without getting tired." It is never too late. Never. Your body always appreciates the change. And if you are already taking medications for blood pressure, cholesterol, or diabetes, never stop them on your own. Those medications are protecting your heart. If you think you don't need them, talk to your doctor, but don't take the risk alone. And please get a cardiac checkup at least once a year. An electrocardiogram, blood analysis, and a cardiac ultrasound can detect problems before it is too late. Now I want to do a review with you. Let's engrave this in your mind and your heart. The 5 warning signs of a heart attack. 1. Pressure or heaviness in the center of the chest. 2. Pain radiating to the arm, neck, or jaw. 3. Fatigue without a clear cause. 4. Difficulty breathing and cold sweat. 5. Dizziness, nausea, or vomiting. The 8 steps to act when alone. 1. Sit down in a safe spot. 2. Chew an aspirin. 3. Prepare your exit and leave keys or codes visible. 4. Recline at 45 degrees with legs slightly elevated. 5. Send a brief text message to your family members. 6. Inhale for 4 seconds and exhale for 6. 7. Press your wrist and cough hard 3 times. 8. Remain calm and monitor your symptoms. The 3 golden habits to prevent a heart attack. 1. Walk 30 minutes every day. 2. Reduce salt consumption as much as possible. 3. Quit cigarettes and alcohol. But there is one more thing I ask of you. Write these steps down. Tape them to your refrigerator, next to your bed, or wherever you see them every day. And if you can, practice them. Act as if you were having a heart attack. Look at the clock. Sit down. Breathe. Act. This is not exaggeration. This is preparation. This is prevention. This is love for your own life. And now I want you to do one more thing. Go to the refrigerator, take a sheet, and write the following. I am prepared. If a heart attack strikes, I will not give up. I know what to do, and I will survive. Read it every day. Make that sentence a promise to yourself and a declaration of life because you are not alone and because you deserve to live many more years with health, happiness, and peace. And now I want you to do one more thing. Go to the refrigerator, take a sheet, and write the following. I am prepared. If a heart attack strikes, I will not give up. I know what to do, and I will survive. Read it every day. Make that sentence a promise to yourself and a declaration of life, because you are not alone, and because you deserve to live many more years with health, happiness, and peace. I am Dr. Alan Peterson, and after 40 years with thousands of hearts, I assure you this. You can beat a heart attack, and today, you have taken the first step. If this video has helped you, please hit the subscribe button and ring the notification bell so you don't miss life-saving content like this. Share it, send it to your parents, siblings, or friends, and leave me a comment writing, I am prepared. That is not just a comment. It is a promise to yourself and a declaration of life. Take care of yourself, and I sincerely wish you great health in your heart and that it accompany you for many, many more years. Thank you for staying with me until the end, and we will see you in the next video.